Okay guys, we're going to talk about internal cardiac epi and internal defib paddles. So when you're getting ready for your level 1 traumas, you're getting all of your equipment together. One of the things I would suggest, easiest thing, take the big metal table in the back of the room, take it into the back recess supply room, and you're going to load it up with all your trauma trays. You're going to make sure you include your 2 green trauma trays, your internal defib, your open chest, your closed chest, a couple of atriums, some chest tube setups, so that way you have it all together. Leave it on the bottom shelf of that metal table. When you bring that metal table in, try to leave that top part of the table clear, at least somewhat clear, so if you need it for opening trays and sterile supplies, you have that available. I also suggest that you have a bedside table available, so that way if you need to take a couple of trays, specifically the internal defib and the open chest, put that on the bedside table and wheel it around to the left side for the surgeon so they have it available and easy access without having to move the big table. Also, with the internal defib paddles, you can use them with both this Zoll monitor and the Zoll monitor that's on the table in the rooms. I'm going to go over using the transport monitor, just that way you can have it with you in case if you have to take the internal defibs while you're still going up to OR or what have you. It's easiest with using this monitor. So, if you are opening the chest, you're going to anticipate that they're going to want the internal defib paddles. Remember, these are sterile trays. So when you go to, you can open it for the surgeon. Make sure the surgeon is the first one to reach in with their sterile gloves. When you pop the tray open, it's going to have the paddles and the wire available. Let the surgeon with sterile gloves grab the paddles out. Then once they have their sterile portion, you can grab the end without having to break sterility on the rest of it. After they've already grabbed their part, you can take this here. So you know on the internal defib paddles, there is an actual shock button here on the handpiece for the surgeon to use. When you're going to plug this into the Zoll monitor, it has the protective cover. Take off your protective cover. Look at your landmarks on here. Take for your pads connector on your Zoll and check for the long piece here. Check to see that they match up. Match your little 3-ring piece together and it will plug right in. Make sure it's good and connected there. Once that's connected on the long piece, this will acknowledge that you have internal paddles connected up in your top left-hand corner. Once those are connected, you need to make sure and hit the select energy button, not the arrow button, but select energy. When you go to actually hit your energy setting, it will give you it will default to 10 joules. The max it will let you go is 50 joules. When you're doing internal defibrillation, the max you can do is 50. More than that, you will fry the heart. Most of the time, the surgeons will start at 10. Ask them what they want your joules to start at. Have it at that. You're going to hit your charge button. Make sure and tell the room you are charging. The surgeon is the one then that will hit the button to actually shock. Again, just like in regular ACLS, make sure to tell the room. Make sure to tell everybody clear. Those are connected. When you are doing the internal defib and you actually have the open chest, you're going to anticipate that you're going to do intracardiac epi. The pharmacist is one that will usually help with that. Normally, I've always been taught you want to use the multi-dose vial. That way it's 1 milligram to 1 ml of cardiac epi. You're going to use the standard ACLS dose, 1 milligram. You're going to make sure and have a syringe. It can be any size. You can use a 3 syringe, a 10 ml syringe, whichever, and a needle out of the carts in the room. The smallest needle we have in there is a 25 gauge. You want to use the smallest needle you can find so you don't cause damage to the cardiac muscle. Don't use a blunt tip. Don't use like an 18 gauge. Use the 25 gauge that we have available. You can technically use your ACLS 1 milligram in 10 mLs. It's preferred you use the multi-dose vial, and that way it's only 1 ml of solution to use, so it's less. It'll be injected into the left ventricle by the surgeon. That is a surgeon procedure. Just make sure you have the supplies available for the surgeon.